So it is 6:04 p.m. This is the Community Board 11 Public Safety Committee meeting of April 22nd, 2020. I'm going to, Yahe, do you want to talk at all, or do you want to just jump over to the FDNY?
I'll just say real quick, thank you all for joining this webinar or telcon, whatever you want to call it at this time. I know we're in challenging times, and we appreciate you dialing in. This is local information. I know we hear the governor speak, the president, the governor, the mayor, but this is really local, and this opens it up for our community to listen in to what's going on locally. So I just want to start off by thanking the essential employees, the FDNY and the NYPD. Thank you very much for all that you do. We really appreciate you, especially during times like this when it's a national emergency. So we appreciate you. And that's all I have. I think we're good to get started with the agenda. We can start with the FDNY.
All right, so Fabricio?
Yeah, I'm here.
Okay, you're on this 212-202 number, right?
Correct, yeah.
Okay, so you have the agenda?
I don't have the agenda in front of me.
Okay, so let me pull it.
However,
Go ahead, Fabrizio. What were you gonna say?
I said, however, I have general talking points of exactly just providing an overview currently of where we're at as the department in terms of overall call volume, response times, and medical leave that really addresses where the department is at right now in overall COVID-19 pandemic. Just to give an overview ultimately on those 3 points that I just made. On the local approach in terms of overall structural fires versus statistics on a more local level, I'd have to circle back with you guys, but I can provide definitely any info post this meeting if we want to fine tune it to more local statistics as well.
Okay.
Tony joined. Jeremy, Tony's there.
Yeah, mute yourself, please, Tony.
Excuse me?
Please mute yourself. Fire department's talking.
Radley.
I know. Please mute yourself. Mute your phone so the FDNY.
Tony Senior Radley.
All right. I'm gonna have to stop sharing screen sharing because I can't view. I'm going to go back to you. All right. So go ahead, FDNY. Wait, hold on. I got to unmute you. And I muted everybody. I got to unmute you. Hold on. All right, go ahead, Fabricio. You were saying?
All right. Yeah. You hear me?
Yeah.
All right. So in previous weeks, the number of medical calls spiked and was very high over a sustained period of time. In late March, we were doing more than 6,000 calls a day. This was a challenge because not only were we the busiest that we've ever been, but we also were experiencing a high level of medical leave among EMS members. However, we took several steps to handle these challenges. We activated the National Ambulance Contract, which was organized via FEMA, and brought over 250 ambulances and 500 personnel from around the country to assist here in New York City. At various times, we have up to 150 of these units helping FDNY within the 911 system. Additionally, we also have called upon private hospitals that already work within the 911 system, which are voluntary hospitals, for the surge and to take on additional tours. Additionally, we've graduated an EMT and a paramedic class early to get more members out into the field. We've also implemented the rapid response vehicles, which are vehicles paired with EMT and a firefighter who is CFRD trained into the field to cover medical runs. One thing is that one key point to highlight is that we made these moves early in the process as we knew that there would be demand everywhere by the time the crisis became full blown. With these changes and lots of overtime, our members have been able to rise to these challenges and complete the mission at hand. Call volume more recently has been trending in a positive direction. Over the last couple of weeks, we've seen a decrease in calls. The last few days have been between 3,500 to 4,000 calls, which is still high, but is much improved in comparison to, as I mentioned, late in March, where we were experiencing over 6,000. We'll continue monitoring to see whether calls continue trending in the right direction. We're aware that other areas have plateaued or even experienced surges after they seem to be past the peak. Regarding response times are fluid and are affected by a variety of factors. When call volume was highest, response time were also higher. The measure that we took to deal with that increased call volume were also about bringing down response times. More units on the street and more personnel were able to get to the next call faster. Response times are also affected by turnaround time at hospitals. When emergency departments are backed up and overloaded, it takes our ambulances longer to deliver the patient and get back out to the next call. We worked with hospitals to try to improve the turnaround times and streamline the delivery process as much as possible. Now, on to the topic of medical leave. We closely track our medical leave, and it's been much higher during these last 5 weeks. We instruct all members who are experiencing symptoms to stay home so that they don't risk spreading the virus to their fellow members or members of the public. These rates also has also trended positively lately, where at one point medical leave among firefighters and officers was over 20% and among EMS members was over 25%. The number today stands at close to 12% for fire and close to 16% for EMS. These numbers are still high, and we look forward to them improving further, but they are improved and trending in the right direction. Members who are experiencing symptoms have the option to stay in department-provided hotel rooms if they wish to quarantine away from their family. This week, and starting last week, we began testing symptomatic members who wish to be tested, and we're close to complete to testing all those members who wanted to be tested, which we were working with various healthcare providers at 55 locations. And next week, we will now start testing those members that do not show any symptoms of whoever wants to get tested. Is there anything, wraps up my update, is there anything specific that I can answer, or any questions regarding these updates?
So you say you're going to get back to us on specific, so obviously within our district, Fabricio, on the agenda we had, we're concerned about what's in our district. Engine 90, Ladder 41, Engine 96, Squad 61, Battalion 20, EMS Station 20. You'll get back to us on what you can on that?
I can get back to you on those numbers. I mean, are you more concerned on medical leave or overall runs, ultimately, the call volume?
I think we're concerned about both.
Okay. I mean, I could check in with the battalions or with the division, both the EMS and fire, and then I could circle back in terms of seeing how this impacted both ends of fire and EMS.
Yeah,
that was very good information. Thank you very much for it. If we can get something more specific for our community board jurisdiction, that would be great. Whenever you have it, if you can just send it to us, send a brief summary, we can forward that to the rest of the members.
And I did, go ahead. Fabricio, did you want to respond to that? Or no, you're good.
No. I just said that we'll do. I can definitely circle back and provide more local statistics if requested.
And I did get your email about for children, education. I think Mr.
So one thing to state is the FDNY, despite the fires in Fairmont, I think we've been quite responsive. I know there was that major alarm fire a couple of weeks back on Kruger, which we provided and started providing the information. That's when we were really transitioning to the digital platform. But it's safe to say now that we are uploading video content every day. We've been sharing with DOE. We've been sharing with not-for-profit organizations, with all the community boards. For those that know, fire and life safety education right now physically is at a halt, where traditionally our firefighters had established outreach campaigns where they worked with different community-based organizations, schools, senior centers, night shift facilities, anything community-based ultimately to provide fire and life safety instruction. Since right now COVID has basically put all public outreach at a halt, we basically now transition everything digitally, and we are uploading new content weekly at this point. Right now we have developed videos that are youth-focused, PSAs that highlight all aspects of general residential fire safety. We released an 8-minute lesson that takes into account what a typical lesson would be within a school-based setting, which again, as I mentioned earlier, we did share with the New York City DOE, the Archdiocese, and the charter school systems. And we shared with all external partners, including all community boards, to pass along. One thing to note in the Bronx, we're hopeful of making a connection right now or cutting a deal with BronxNet, because apparently with certain DOE sites or students, they don't have the tech as of yet, and some of the curriculum has been being aired in community television. They're going to start airing the FDNY in between curriculum and in between lessons. They're going to start airing the FDNY lessons to all Bronx through the Bronx Network. We do have a 45-minute adult presentation, which provides general residential fire safety, which is on the current website. And we are going to be breaking up that general residential fire safety presentation into 4 segments to make it more digestible for a more older population as well. For those that don't have it, the website again is www.fdnysmart, all one word, fdnysmart.org/connect.
So Fabrizio, since you mentioned it, everybody knows about the fire. We had a fire in Kruger. I forget the exact address. This is basically right at the start of the crisis here, where families were displaced. It was a big fire. One of my board members reached out to me about it. I will share information with the board since I forgot to do that up until this point. I don't know if you recall that fire by chance.
Yeah, I actually, if you give me a second, I can actually pull it up. Do you want the specific on the total patient count in the car?
Whatever you can give us, whatever you can give us is appreciated.
All right, hold on a second. I'll put you on hold just for a second. Let me see if I can get that real quick.
Yeah, fire was at 2528 Kruger Avenue. It was a 3-alarm fire. The Red Cross provided assistance. They had 20 registered families, including 64 people, 43 adults, 21 children. Go ahead, Fabrizio.
I got it right here from the fire department sentence. As Jeremy mentioned, it was a 3-alarm fire that occurred at 252 Kruger Avenue. Per FDNY Fire Marshal, the cause was accidental electrical cooking toaster oven. Smoke alarm was present and operational. Total patient count from our end was 4. 1 patient transported in critical condition and 3 patients with non-life-threatening injuries. That's pretty much the report that we had. Again, the cause was accidental electrical. It looked like due to a cooking toaster oven.
Okay. Anybody have any questions on that or anything else so far?
Well, let's hold, from the committee, Public Safety Committee members, do you have any questions so far? Because I think you can unmute yourself. We're waiting for the public until the end.
So, Tasneem, or go ahead. Ellie?
No, he gave us good information. Thank you.
Good. Tasneem or Veronica? No? Good? Okay.
No, good, thank you.
Yeah, no question.
Okay, and then I did ask, so if Melanie LaHose or Joey Schensler join the meeting via phone but not computer, you need to text me or email me so I know, so I can unmute you or figure out where you are in the meeting if you have a question or anything. So then, with that being said, I think we're done with the FDNY, right? Yeah. Hey? Yeah,
we're good. We can move on to the NYPD, and if the FDNY can hold until the end of towards the end of the meeting, just in case anyone has any other questions. I don't think this would be long anyway.
Okay.
I'll stay on the phone.
All right, I'm going to mute you for now, Fabrizio, and then I'll unmute you after the NYPD. So, Captain, can you unmute yourself, or you want me to do it? I'm going to unmute you. I got you. There you go.
There it is, right there. All right. How you doing, Jeremy, everyone? I'm here tonight with my 2 community fair guys, Jay Sturdivant, James Graham. Hello, everyone. First, I just want to thank everyone, specifically the community, the business owners, and all of our politicians. There's been a lot of support by everyone for the 49 precinct, and I just want to let you know, on behalf of the 49 precinct, I speak on everyone that we really do appreciate the support. One of the things I just wanted to get into that's on the agenda is our staffing levels. To give you a little bit of a baseline, the 49 precinct has approximately 150 full-duty officers, basically officers that can go out, patrol the streets. Normally during the course of the year, usually about 7% or maybe 10 to 15 officers are out sick at any given time. During the beginning of the coronavirus outbreak, talking probably the last few weeks of March, we started to see a sharp increase of officers going out sick. At one point, probably the earlier part of April, we had approximately 40% of our precinct, or about 60 police officers, were out sick. So obviously, we kind of were limited in our capacity. But a couple of the things that we were able to do is we canceled and suspended all unnecessary training for the officers. So what that does, that puts more officers out on the street for us. Also, all court appearances were canceled, and we were getting backfill from other units. So other units throughout the department, like drug enforcement units, ATF units, things of that nature, they were being repurposed to come to the 4-9 and different precincts of the Bronx to backfill the officers. So although we had a number of 4-9 officers that were out sick, our minimum manning and our patrol staffing was still virtually the same. Currently, as today, as I speak, we have a total of 29 officers that are out sick, about 19% of the command. And during the last 6 weeks, we've had a total of 29 police officers that tested positive for the COVID-19. Every day, we're seeing more and more cops coming back to work. As of Monday next week, we're projected to get 8 more officers out sick. And of course, the rate at which we have officers going sick is dramatically decreased. During the last 6 weeks, regretfully, we did have a civilian member of our staff pass away, Ms. Giacomina Brown Barr. She was a civilian here at 4-9. She's worked here a couple of years. She did our roll call. Great lady, really nice. I used to talk with her every day. She was an integral part of our staff, and she's going to be greatly missed. Just a couple of things that we're doing here from the NYPD level regarding the corona outbreak. We're seeing a large increase, uptick in 311 and 911 calls regarding social distancing, and people calling on different commercial businesses as far as people not following the mayor's executive orders. So we're being proactive. We do have particular offices on each tour that are dedicated specifically for those purposes. Generally, we're seeing compliance with the mayor's order. Not early on, we did have, I won't get too much into detail unless you need me to. We did have one business on Morris Park that failed to comply with a couple warnings, and we had to write a couple summonses, and as of right now, their liquor license has been suspended and they're not in operation. But generally, the 4-9 as a whole, from what we've seen, generally in compliance with the mayor's executive orders. Another question is, what's the crime looking like for the last month or so? So I'll just give you a little synopsis, starting with the whole year. The 4-9 precinct for the year, we actually are up in crime slightly, 10% increase. We're down in all categories except for burglaries and grand larcenies of the auto. That's going to continue over into our last month, our last 4 weeks. Overall, though, we have a 19% reduction. We have major decreases in robberies. We're down 63% in robberies, 48% in our felony assaults, almost 50% in our grand larcenies. The only 2 areas that we're seeing increases are basically property crimes. Those are going to be burglaries and our grand larcenies from the auto. And now, the last 4 weeks, we've had 13 burglaries versus 5. That's an increase of 8 or 160%. What we're starting to see is commercial businesses. Commercial businesses are starting to get hit. Some of them are closing down for an extended period of time. They don't have alarms, and when they come back to check in on their shop, they're realizing that their location has been burglarized. One of the things that we've done, we requested additional resources from Patrol Borough Bronx. They granted us a extra sergeant and 8 police officers that we're deploying on the first platoon. That's on midnights. That's from 11 o'clock at night till 8 o'clock in the morning. And basically their sole function, they're going out and they're going into the business districts, Morris Park over on Allenton Avenue, Boston Road, White Plains Road, Leidig, and they're going and they're checking the different commercial locations. They're checking the padlocks to make sure everything is locked up. And if they see anything suspicious, they're questioning these individuals who are out there at this time. The other area that we're seeing a increase, we've been fighting this all year long, is our grand larceny autos. The hot cars are basically any newer model Hondas, any model Accords, CRVs, Pilots, and Acuras. Acuras and Hondas are the same company. Basically, what we're seeing is there's a organized theft ring that's operating in the Bronx. As of right now, primarily they're operating in the 4-9. And from what I understand, there is a case into these individuals. So we anticipate probably in the next month or so, this case is going to be taken down, and hopefully we see a sharp decline in our GLAs. Unfortunately, sometimes it takes a little bit of time in order to build a solid case against individuals like this. What else can I say? So I think as far as crime, generally the city and the Bronx has seen a decrease in crime, except for property crimes. Like I said, GLAs are up, not just in the 4-9, but in the Bronx, as well as burglaries, and it's up citywide. Does anyone have any questions about the crime or anything else going on in the 4-9?
So anyone for the Public Safety Committee?
Didn't we have a shooting at Kruger recently?
Yeah, the shooting on Kruger. Yeah, so this past Sunday at about 5:30 at night, there was a dispute between two individuals. One of the individuals, an older gentleman, he pulled out a firearm. He struck his adversary one time in the leg. He ends up leaving the scene. The 4-9 squad does a great job. They're able to identify the perpetrator. The CV is removed to Jacoby Hospital. He's not likely to die. He was in stable condition. About 2 hours later, officers from the 4-9 precinct observed the male perpetrator walking down, I believe it was White Plains Road. They were able to grab him, and they were able to grab the gun. This individual has an extensive history, 58 years old, and he probably will spend the rest of his days in jail.
Thank you, Captain.
You're welcome.
And Captain, thank you for that. I just want to confirm something. If you can confirm the crime overall, whether it was an increase or a decrease year to date and just the past month. Can you go over that, just the overall increase or decrease between the two?
Yeah, sure. So in the 4-9, the overall increase, there is an overall increase of 10%. So now the things that is driving the increases year to date is going to be our burglaries and our grand larcenies from the auto. And for the 28-day, we're actually down in crime, approximately 19%. We're down in all major decreases in all crime categories, again, except for burglaries and our grand larcenies of the auto.
But you guys, unless you have something, I think that's it for or Tasneem. I think that's it for the committee, unless, again, unless I have the other two committee members in and I don't know about it.
Any other committee members have any questions for the captain? All right, I think we're good there. Jeremy, do you want to just go over some quick stats for since the hospitals, we invited the hospitals to join, but they couldn't join. So Jeremy, if you want to give us just a quick briefing.
Yeah, I'll do my best. Obviously, I'm not a medical professional, but let me share my screen real quick. Some of this stuff, a lot of board members have received stuff already. So street activity permits, which the precinct reviews, they've been canceled. Any street activity permit, festival, parade has been canceled all the way up to the end of June currently. And some other things to be aware of, some other things I've shared, fatalities from New York State, comorbidality, or however you want to call it, is very important to, if you see here at the bottom of my screen, those are using a computer. You can see the primary cause of death, underlying cause of death, aside from COVID-19, is people with hypertension, followed by diabetes. That statistic, that diabetes, that was happening in China. I forget exactly what the first. Cardiovascular disease, which can include hypertension, I think was the number one contributing death for China. I don't want to bore people with stats. I would publish stats almost on a daily basis in terms of what our zip codes were doing. Lately, I haven't checked for maybe 2 days now. It's been dropping versus like a 7% increase every day. It's been dropping down to like 2% increase in terms of those infected. And you can get this. I can get all this information is public if you know where to find it. Not everything. There's board members have asked me for stats by community board. I hope to get that. I would not hold your breath. But with the city, one other thing I'll note with the city, rates by age, rates by sex, still in New York City, more men are contracting COVID-19. More men are being hospitalized. Almost twice as many men are dying from COVID-19. Right here, download data is where you can get the exact zip code information. It's going to take you to a different site because the testing is done by Montesano, I believe. And you can find this exact information up to date with 422 data. That's today. Number of people testing positive out of total. A majority of those being tested in the Bronx are testing positive. So more than half of those being tested are testing positive. It's obviously not a good thing. You can see 10460, the current positive stats, 1106 out of 1900. So that's more than half, right? So all this information is public. You want to know where to find it. I want you to talk to me outside of the meeting. I think that's good enough for now. We did invite Jacoby and Montefiore Medical Center, and Jacoby could not come. Montefiore, I don't think we ever heard back from. So unless there's anything else, any other committee member?
Jeremy, no, thank you. That was good.
Okay.
That was good. Any committee members have any questions for Jeremy?
Has anyone been in touch with Kings Harbor about what's going on over there?
Yeah, so I've been in touch with them. I did. So I reached out to them over the weekend, didn't hear anything. Assemblymember Fernandez, you might saw in my email, forwarded me a press statement that they put out on Friday. Let me, I could find the email and just read it to you. Basically, their argument is got to put everything into context. They have 720 beds or something like that. So naturally, they're prone for they're likely to get higher positive results. I know that last time I checked, I think when we had this run call on Monday, they were being, other boroughs, Queens, they were catching up. And the other thing to keep in mind is that, at least according to what I've read and seen, is this is self-reported data currently. I don't know how self-reported it is if you have, a death certificate because you're involving the coroner or the medical officer. But that's what I've read, and not every place was listed in that sheet because they didn't have more than 5 deaths. There's probably something else I could add to it. If there's something specific you want to know from Kings Harbor, just let me know. Ask me, please. And I'll try to get it. I'll reach out to them. But I have, once I got the statement from them, I emailed the contact, and he was very good about responding to me right away. And they said they're good on PPE currently. I'm going to mute everybody. Hold on, because I keep hearing too much feedback. So they're good on PPE currently. They're stocked enough. So I really don't. Any other questions? You have something specific, Veronica, you want to know?
Yeah, how many cases do they have now? Do we know? And how are they treating the patients? What are they doing with them once they test positive?
Okay, I don't know if that's public. That's something I have to ask them. How many? You want to know how many total? I gotta keep muting everybody for some reason. You want to know currently how many patients are positive, not just fatalities, right? Because the list that came out by the state was fatalities.
Yeah, no, just a number of cases that they may have or have had so far.
Okay, I can ask for that.
Yeah, and just are they quarantining the patients separately from the patients who haven't tested positive? Just the information on how they're actually treating the patients, basically, when they test positive.
Now, I don't know if you saw in my email that somebody was making an argument from the Nursing Home Trade Association or something like that, that they were criticizing the state for their policy of having nursing homes take in hospital patients. I think the governor was kind of caught off guard by a question related to that. That's just something else to be aware of. I'll follow up, Veronica, with your questions.
All right. Thank you, Jeremy. I appreciate it.
Okay. Any other committee member? Because I muted everybody. Tasneem's on the phone. I just unmuted her. Melanie, any other? I know you just joined us late, but we had the FDNY, we had NYPD. I think we should open up to the public, Yahe.
Yeah, I agree, and we can go in order. If anyone has anything for the FDNY, if not, then they can drop off, and then we'll go through the precinct. If no one has anything for the precinct, then they can maybe drop off. These are optional if they'd like to drop off or not. Then we'll continue normal business. We don't want to take any more of their time.
Yeah, before I unmute everybody too, for those who are using the computer, there's this chat function. If you're not familiar with how to use this program, you can always text message me. That's what happened during leadership. Ideally, if somebody else is talking, you have a question, send a chat, send me a text message, something, so at least we can kind of have some type of order versus everybody trying to talk at once. I'm going to unmute everybody, unless there's anybody that's able to unmute themselves and has a question.
There's a question in the chat, Jeremy, if you want to read it.
So what is the availability of testing for everyone? I mean, I know NYPD, you guys can kind of front load people. FDNY should be able to front load people for testing. I think that's what happened in the case with the civilian employee. You got her tested right away. Unfortunately, that didn't necessarily help. Anyone else? I don't have an answer to that. I know when I was sick, you had to basically be dying to get tested. And when I had a conference call with the BP's office maybe 2 weeks ago, they basically said that's the same policy. I know I had a friend. The only way he got tested is because he got hauled away in an ambulance. So I don't have an easy answer to that question, World. So somebody else had a question for the 4-9, Bernadette.
Yeah. Hi. This is unrelated to COVID. It has to do with the situation that happened on Fillmore Street about a girl that was missing. I was just wondering if anybody had any update on that. It was on, just looking over here, Fillmore Street was on, sorry about that, I moved it. It was on April 14th. There was a missing 14-year-old Hispanic girl. And I didn't see any Amber Alert or anything, but I was just wondering if there was any follow-up.
Bernadette, I'll have to get back to you on that. I'll
Okay.
get back to you offline if you like. But as far as Amber Alert, there's very specific criteria when it comes to an Amber Alert.
Okay.
You may not believe this, but on a given day in the 4-9, we may have anywhere from 0 to 10, 15 missings a day. It's basically what they get classified as. In this particular case, from what I understand, it was kind of more of a runaway.
Okay.
And not a missing.
Okay.
So definitely, what happens with Amber Alerts, we try not to use the Amber Alerts unless it specifically fits the criteria, because like the old adage, if everything is important, then nothing's important. So if an Amber Alert's going off, on your phone every 15 minutes, you're going to stop looking at it. So it's only reserved for the really, really extra special ones.
Okay,
I'll
thank you.
get back to you with the end result.
Okay. I do have another old business, and it was an answer to a question that Tony had asked in a leadership with regards to the emergency rooms. I did get a call. Is it okay if I just respond to that now?
Yeah, well, the only question is it something related to the FDNY? Because I want to try to get them out of here first.
Okay, no, it's not. I could wait.
I have a question, Jeremy.
For the FDNY?
Yes.
Okay, go ahead and ask your question, then I'll unmute the FDNY. Go ahead.
Okay, I was just curious where the fire on Kruger Avenue was.
So, I don't have it in front of me. Fabricio, do you have that in front of you?
It was 2528 Kruger Avenue. Hold on, I'll tell you the cross street. Hold on a second.
So it's north of the Parkway, obviously.
Thank you.
So,
Yeah, that's between Allerton and Mace.
Thank you.
and
That's correct.
Fabricio, we had a question about a fund. Is there some type of fund for families? I know the Red Cross gets involved. Can you elaborate on the extent that they get involved, if possible?
I can't really speak on the fund for the families because that's more of a Red Cross direct question. I mean, the FDNY doesn't really get involved in terms of the funds for impacted families or anything. I could connect you after this call or offline with the public outreach or community affairs from Red Cross.
Yeah, I think you've done that already.
Oh yeah. So they would have the better insight. I wouldn't have the insight on any funds for those displaced or any of the families that are impacted.
Okay, so I'll follow up on that, Diane. Any other
Thank you.
Any other FDNY questions? So if not, then I'm gonna say goodbye, Fabricio.
Thank you, everybody, and stay safe.
Thank you. All right, and then so Bernadette, we want to follow up with that? I don't know if there's somebody else that has a question.
Yeah, I can make it quick. I got a call back from the chief of staff from Assemblymember Karina Reyes Glendelis, and I had asked two questions. I had asked about getting masks for some community, for the community, because some people do not have access to masks. They're going to look into that, of course. I do know that a candidate that is running for the New York 14th District, Michelle Caruso Cabrera, was actually able to get masks sent to Monsignor Fiorentino this morning, which we're very grateful for. I don't know the amount, but she did get them to the seniors. So that I wasn't expecting that. But the one thing I did ask, because I know that Karina is she's in the trenches right now, and she's keeping herself distanced from everybody because she doesn't want to infect anybody. But in answer to Tony's question, in other words, which ER would you go to if she would have some information? And she said they're all overwhelmed, but it would depend on the symptoms of the person. If somebody is in critical distress, go to the closest one and its amount of wait time. But if somebody is not in critical, going to Lower Westchester, like to St. Lawrence, or even going to Barnabas, St. Barnabas, is a possibility. And I did not know this, and maybe everybody else does, but St. Barnabas does have a specialty. I guess they're like Jacobia's trauma. They do have with asthma. They do, which deals with respiratory. So that I was not aware of. But if there's an issue with respiratory, St. Barnabas does. They're overwhelmed, but that would be the place to go. I don't know the amount of ventilators they have, et cetera, but
Okay.
I just got about an hour ago.
Okay. So, for the Thor 9, because I don't want to forget about them, and I want to cut them off or cut them out because they probably have to go. I know we got a question about homelessness. There's been an increase, maybe, or a concern that there's more panhandling. That's Jean's question, Jean Veronica. Somebody else maybe had a question about that. You want to elaborate on that?
Sure. So on Allerton, we've been hit since the businesses have been shut down and most of the families are staying indoors. The streets have been overtaken by the panhandlers and the homeless population. Since there's a stay-at-home order, what's the city or state doing to ensure there's shelter for these individuals?
Well, Gene, regardless, like you said, to the homeless population, we do continue to do outreach. But as far as us being able to physically remove them under a mayor's executive order and bring them to a shelter, we have not been informed that we're able to do that. There's no standing order as of right now where we can remove them to a shelter. Like in the winter time with a cold weather emergency where we can force someone to go to shelter. We have not been instructed by the department to do that with the homeless.
Thank you, Captain. So my question is, Jeremy, why haven't they made that order? Because they mandated that the officers, make enemy with the people here because they're finding people. I don't know if I haven't had any reported cases here in the 4-9. I've heard the opposite, that the officers are being very cordial. But in other parts of the city, residents are being arrested, detained because of escalation of the stay-at-home orders and social distancing. But there's no order or executive mandating to take care of the homeless population. So we're largely concerned.
So, Captain, I don't know if you want to speak a little bit further on this. I would assume just simply it's why are you going to get I mean, would it be very difficult for you guys to, I don't know, force everybody into a homeless shelter?
Yeah, what
as
we
of
can
right
do
now,
is if they're just like anyone else, whether they're homeless, they're residents in the 4-9 precinct, if there are a group of individuals hanging out, 10, 15 people hanging out, yeah, we will break them up, we will disperse them. Like Gene said, we are issuing warnings. If they refuse, then we will take enforcement action as necessary. But again, 3 or 4 homeless individuals on the corner, we cannot physically take them and remove them. If they volunteer, we will be more than happy to help them place them in a shelter. But most times they refuse to go, and we're not able to force them to go at this point. There's no standing mandate or directive.
Okay. All right. So again, if you're not talking about the question, can you please mute yourself? If you're not a question, you're not talking, mute yourself. Any other questions for the 4-9? I'm gonna mute everybody except is anybody that's using computer has a question. I'm gonna mute everybody because it's just too much feedback right now.
I just want to follow up with one thing, but I don't know if it's necessarily the 4-9. But what's the standing procedure if a man is sleeping outside on the streets and we don't know if he's ill or just intoxicated? Is there a process in order?
But
If that comes over as a 911 call, it's likely a police officer will respond, and police officer will assess the situation, determine if the individual is intox, sleeping, or unfortunately DOA. If the person is intox, then likely we will call an ambulance and have him removed to get him medical treatment. If he's just sleeping, he or she is sleeping, we'll usually wake them up and have them move.
all right, so let me unmute everybody for people who called in and didn't use a computer. Any questions for the 4-9 precinct before they go? Anyone? Please mute yourself if you don't have a question.
I have a question.
Who's
Joanne?
that? Joanne?
Joanne. Yeah.
Okay.
I had heard.
Hold on, Joanne. Joanne, let me mute everybody. and then I'll unmute you. Go ahead, Joanne.
Okay, I had heard a couple of weeks ago, the mayor had said that he was looking to put homeless into hotel rooms. Is that anything that's realistic, or is that had been abandoned?
I unmuted you, Captain.
Okay.
It's Director 49. Again, this is something the mayor spoke about, but nothing has been pushed down to the lower levels of the NYPD, where again, we can, you think about it, we would have to take an individual who doesn't want to go, force them into a back of a police car, and then take them to a hotel and force them in there. Again, we are not at that point where we're allowed to do that, nor have we given any directive or basically any supporting law that would support us in doing something like that.
Okay, well, thank you.
You're welcome.
Okay, so I'm going to unmute everybody. Hold on. Just for the people that called in. Any questions for the 4-9? Final call. Okay.
Jeremy, Tony Signorelli.
Yeah, Tony.
Jeremy, question. You mentioned something about the mayor that he has canceled parades. Was he referring for the entire year or monthly?
Say that one more time.
You mentioned earlier that the mayor has canceled all parades. Was the mayor referring for the entire year or monthly?
So, let me unmute you. So, as far as I know, all activities are canceled up until June, until the end of June. Is that
okay?
The Jay or the captain, am I correct on that? Do you know?
Yes, you're correct. Up to the end of June, correct.
And that's currently. It could be longer than that. We don't know.
Yeah, I know.
Okay.
Thank you.
All right. I don't want to keep asking. Okay. Final call. Please mute yourself if you don't have a question. All right. Thank you, Captain.
You're welcome. Thank you.
Yeah, Captain, thank you very much.
Take care, guys. Yahe, take care.
Okay.
Bye-bye.
I'm gonna unmute Councilmember Jonai's office. I know she texted me over the weekend or Monday that the council member spoke to Kings Harbor and that they said they had over 700 beds and that the deaths are overinflated. They had COVID-19 cases sent to them from Montefiore as well, which accounts for most of the numbers. So let me find Farah and unmute her and see if she wants to add to that. If I can find her, if she's still in the meeting. Here she is.
Yeah.
Let me mute everybody because there's feedback. All right, Farah, you're unmuted.
Okay, thank you. Yes, thank you for mentioning that. The councilman has been speaking to them. He has been reaching out to a lot of nursing homes because we are offering COVID cleaning in some of the common areas if it's needed. Like Providence Rest Nursing Home, we just did a cleaning. I also just want to let you guys know, not that we have them, but we have been able to organize getting much needed PPEs to some of the nursing homes if needed. So like Providence Rest, we got them 400 masks. We're working with some of the NYCHA facilities to get the seniors some masks. So if you know of like a facility like that or they're asking about it, you can also reach out to us to try and facilitate that as well. We also had a request from a Jean Jugan nursing home. They desperately need sanitizers. So we're working closely with the governor's office to get some much needed supplies in the district.
Okay.
I just want to make sure you knew that.
Okay.
Thank you.
All right. So, Yahe and the committee, I just muted everybody. Maybe I should mute you all. Unless there's any other public participation, we're gonna turn it back over to the committee for old business, new business. Anybody else? Public comment? All right, then I'm gonna mute everybody. Yahe, do you want Yahe and the committee? Does everybody else have
All right.
anything?
I don't have anything. We can move on to, does anyone in the committee have anything before I move on to old business? So we can wrap it up hopefully within an hour.
No, I don't have it.
Ellie, do you have anything? Tasneem?
Or Melanie's on the call now, too? Unless there's anything,
All
I
right.
guess.
I think we're, all right, I think we're good. We can move on to old business. Does anyone have anything for old business? I don't hear anything. I don't see anyone speaking, so we'll move on to new business.
Okay.
All right. Looks like I'm not on mute because it's too quiet. I couldn't believe it. I thought I was on mute for a second. I'm like, okay. All right. Again, thank you all for dialing in. I know this is a tough time, and I thought if any committee would hold a meeting this month, it would be public safety for sure. And very good questions, very good engagement by everybody, including the committee. Thank you very much for your attendance. We'd like to adjourn at this time, and I don't think we need to vote on adjournment or a second or anything like that for committees, I believe. But if no one else has anything else, we'd like to adjourn.
Yeah, so the meeting's going to end officially at 6:56.
Thank you, everyone.
Thank
Thank you.
All right. Thank you, everybody.
Thank you.
Ow. Ow.
Al,
Ow.
stop the recording.